Today I want to talk to you about balance and fall prevention. This is one of the emphasis we have in our clinic at Waldo Rehabilitation Health and Wellness. This is a growing concern as we have more and more aging baby boomers uh, every year, and because balance is a problem that occurs more frequently as we age. We recommend, a screening of a balance in all patients age 50 and over. So our balance is made up of, or integrated or controlled by our central nervous system, which is our brain spinal cord, and our peripheral nervous system. Now, it's the integration and coordination of that, and with our visual tracking, our eye-brain coordination, the vestibular part of our ear. We have two parts of our ear, hearing and vestibular. Vestibular has this little semicircular canal with fluid in it, and we have little rocks in there. They're called otoliths. So if anybody's ever told you have rocks in your head, they weren't lying. We actually do have rocks in our head. And the other mechanism of this, it has to do with our mechanoreceptors in our spine, our head position. That's why our posture is an aging process if we have forward head lean. Mechanoreceptors in our lumbar spine if we're leaning forward at the waist. Those things affect our balance. Our balance is also affected by our core strength and our lower extremity strength. And also our ability, the proprioception that we have in our feet. One of the reasons that we're having so much more balance issues in this country is because of the increased incidence of neuropathy. So people are developing neuropathies on the rise, which is affecting the function of the feet, the feeling of the feet, the strength in the feet, and which is increasing our risk for falls. Falls are very serious in the geriatric population. Just a couple of very frightening statistics. If a geriatric patient falls and breaks their hip, they have a 50% mortality rate within 1 year. These falls can be devastating. They can be life-altering, life-changing. They can be life-ending. When we look at falls from geriatrics causing head injuries, we're talking about hundreds of millions of dollars spent every year in treatment. Very serious problem. We take it very serious. We feel, based on what's available today, the best assessment for a balance is using a combination of video nystagmography. Video nystagmography is like advanced EEG. It actually involves wearing a mask, it's kind of like a ski mask or a scuba mask that has a camera in it, and we have the patient do visual tracking exercises. They're moving left and right, up and down, and have the patient position their head in different provocative ways, things called like the Hall-Pike maneuver, different things that have been showed to cause nystagmus. Nystagmus is an abnormal motion in the eye, rapid movement back and forth, and this is what the camera is trying to detect. Also, we blow hot and cold air in the ear to evaluate vestibular function. So this, coupled with a sway test on a balance, we have two different type of balance evaluators in measuring sway. So normally we sway a little bit, but it has to do with when we sway, how far we sway, then also how we correct. So normally we're like a little top. We have very little, sway patterns. We're just, kind of moving. We're always constantly adjusting. When we see deviations prolonged to the left or right or forward or back, and these long things, that indicates disturbance in the balance and indicates there's an increased risk of a fall. The good news is that in most of these patients, again, 4 out of 5 patients, 80% plus, respond. If you've heard me speak before, I talk about percentages all the time. I'm discouraged by the lawyers, discouraged from doing it, but there's a reality in natural health care when you're doing things that are naturally right. you fall in that range. It falls in that 80% of the time, all the time. I see that statistic a time and time and time and time again for all different kinds of things. So 80% of the time these patients can restore that function because we can do a maneuver. We can do eye exercises to improve their eye-brain coordination. We can reset the rocks in their ear with something called a Canalyth or Epley's maneuver. It's just a mechanical motion that we go through the head. We can work on their posture, their rings. We can release, we can correct the facet, the mechanoreceptors in their neck and the back. We can strengthen the lower extremities. We can increase the feeling in the feet. So most of these patients, we can increase the capacity or their function, so we reduce the risk for a fall. We're one of the, there's probably only a handful of facilities in the metropolitan area that have this capability diagnostically, and I don't know of any other facility that has it, the combination of the diagnostic equipment and then the treatment we have for that patient. We have a very unique system called NuWeight, where we can have a patient in a vest, like a climbing vest, and they're anchored in, and we can have them on a treadmill moving, so we can have a patient moving forward, moving backward. They're anchored in so they can't fall, so we use this to work on their proprioception, work on their balance, work on their strengthening, and we can, if the patient's legs are weak, we can offset the weight, take weight off of them. 50 pounds, 100 pounds, has up to 350 pound air compressor on it that we can take weight off. So this is a great tool for the balanced patient. So if you're watching this and you've had some balance, dizziness, vertigo issues, I encourage you to come and get evaluated. Or you may have a friend, or you may have a mom or dad or granddad or grandma who has that problem. So I encourage them to call and make an appointment, because in most cases we can improve this.